Does that mean that I started talking? I started presenting?
Yeah. So now, yeah, I'll start. Good evening, everyone. Thank you so much for coming to One Healing Space. So today it's an webinar that's provided by Mia Song. Our topic today is about mental health consequences during the COVID-19 pandemic. I know Mia has done an extensive research on different papers, like how mental health is actually affected by the COVID-19. And thank you so much for the audience who's joining us today. I want to introduce One Healing Space first. So One Healing Space, we started in October 2019 with the mission to, one is raise mental health awareness. Second is to provide counseling and psychotherapy services to university students, especially international students, and also young professionals. I do know there's still a stigma where people think when I talk about mental health or mental illness, it means that I am sick or I'm not normal. So today, Mia will, I guess I'll hand it to Mia and you can start by telling us like what you find. Thank you.
All right, thank you, Cindy. So first, a warm welcome to everyone that joins the presentation today. I am Master of Biochemistry student, so I have some research background in biochemistry. Mental health is not my specialized area, but I like to look at this problem from a research perspective. So today I'm going to talk about mental health consequences during the COVID-19 pandemic. And because it's not my specialized area, it might not be the most professional presentation. Just listen as like if it satisfies your interest. So first, a summary of my presentation. I'm going to talk a little bit about background of COVID-19 and what it means to have mental health, to have a healthy mental status or having mental illness. And I'm going to talk about some current findings in the research. What are some implications of the findings in the research? What does it mean? And how's that related to the public mental health services? And finally, some ending remarks and in terms of what we can do to self-help and help others in this pandemic. So first, some general background of COVID-19. COVID-19, it is an illness caused by coronavirus. So I think everybody's probably very familiar with it now. Coronavirus is a large family of virus. It affects animals, infects human. It's a new disease caused by SARS-CoV-2. And it is contagious. So it's mostly common to be spread from one infected individual to another individual through coughing or sneezing. And because of this contagious character of it, we have to, be isolated and be in practice social distance to prevent the spread of the disease. Some common symptoms include coughing, shortness of breath, elevated body temperature, muscle weakness, fatigue, and loss of smell and taste. So most of those are physical symptoms. And to prevent the spread of this virus, as I mentioned, we need to practice social distancing. And that means we not only have to be far away from each other when we see people, avoid human contact, but also stay at home most of the time. So avoid larger crowd, avoid human interaction. And that means there is going to be an increased element of isolation, and that isolation could affect our mental health and could bring dramatic changes to our daily behaviors. And that leads us to think about, how that's going to affect our mental health. So a little bit more background. During this COVID-19 situation, we have to think about what's happening in Canada, and because we live in Canada, how that's going to affect us, right? So first, overall in Canada today, statistic shows that the highest amount of people that's being affected are in Ontario and Quebec. And mathematical calculation and prediction shows that it's possible that COVID-19 is going to spread, even influencing higher amount of people. So this is a trajectory of how the population is going to be affected in the future. The blue color shows that the number of people might be decreasing, or the brown color, or maybe, increasing in a slower rate, or the orange increasing in a skyrocketing way. So, well, obviously these are the three possibilities, but it also tells us that we need to take COVID-19 seriously, and it might affect every one of us in the more dramatic way, even though it is already very dramatic. And let's look at, for Ontario, the number of people that's being affected by today to October, I think it's like October 16th. It is still increasing. The number of people is still increasing. So at this point, the risk of Canadian of being infected with COVID-19 is considered very high. So I know us as a group of people are likely to be young, and people that's listening to this presentation and in One Health community are likely to be around 18 and below 30 years old. So my presentation is going to focus on these age group. So up to recent month, CBC News has reported that the frequency of symptom affected by age is showing that in this graph. It's showing that different symptoms of populations being affected, the percentage of these people being affected, and dividing them by the age group. So we can see that the darker color of red indicates a higher percentage of population being affected by these symptoms, and the faint color of red indicating a lower percentage of people affected by the symptom. Surprisingly, we can see that actually there is a high amount of people being affected with symptom at the younger age group, which is different from how we predicted earlier when the disease starts to spread. And a very interesting graph that's comparing the amount of people being affected at different time in Canada. It emphasized that the 20-something, meaning the age group, so age group 20 to 29, is now actually the top amount of people being affected in Canada. So let's look at this graphic as it changes. We can see 20 to 29 age group at first, when the outbreak starts, it's actually the lower amount of population being affected. And by the time in the end of October, so right now, it is now the leading group of population has the highest amount of rate being affected. So that makes us, I know, like as us, as a group, we are actually within this group, right? We are around 20 to 29 and that just means that we need to pay more attention to this change and actually practice social distance, even in a more strict way. And that brings a lot of mental stress and a lot of difficulties, as we have already been in this social distance, this situation for so long. I know everybody is probably feeling fatigue of the social distancing, isolation, being far away. And I just want to also mention that Probably a lot of international students are listening to this presentation, and as international students, we are away from our family, and that makes it even harder for us, like being in a foreign country, right? So why bother with mental health? As I just explained, there is a lot of factors related to COVID-19 that is going to influence our mental health. So this research shows that there are many factors brought by COVID-19 is going to lead to increased amount of anxiety, depression, and stress symptoms due to this change of society and the fear towards the pandemic. So what are these factors? Generally, there is a lack of knowledge towards infectious disease and health behavior. So not knowing what it means to get infected by COVID-19, or the fear of COVID-19 might brought a lot of anxiety and depression, and that's because the unknown factor. Another thing is a lack of knowledge towards mental health. So especially as international students and younger people, we might not have a very abundant life experience. And that leads to a lack of understanding towards mental health and self-protection. Because of that, you might not be able to monitor your mental health and help yourself, or even aware that you are experiencing mental health issues. So another thing that might influence us is economic problems. So there is a lot of drop in the market in the economic perspective. There is financial strain. As younger people, you don't have much savings, and you might like easier to lose your job. So those things contribute to your stress level and might bring difficulties in maintaining a good mental health. Another things includes exacerbated health inequality, family dynamics, trauma experience, losing significant ones, losing a friend, or experiencing like your own disease kind of things. That's going to put you into a higher risk of feeling anxiety, feeling depressed. Finally, there is pre-existing conditions. So if you already have mental health issue or you have disability, makes it that much harder for you to maintain a good health at this time. So when we look at what's happening in Ontario, the landscape of mental health in Ontario, because that affects us, most of us live in Ontario right now. So let's look at what happened, what the statistics shows in Ontario first in 2011 and 2012. This statistically shows that in that time before the COVID-19, younger people report above 80% of being in the positive mental health situation. So in this graph, we can see we have a relatively healthy population in Ontario right now, and having a positive mental health is extremely important because it gives you the capacity to feel and think and act in a way that enhances your ability to enjoy life. It gives you the ability to be resilient when there is stress and crisis coming to your life, allows you to feel satisfied and feel gratified towards life events and have the willingness to enhance your quality of life. And when we look at this graph, we also can understand that there is already pre-existing about 10% generally in the population of people that's self-reporting a lower mental health status. So in that case, when you are living with mental illness, it doesn't just influence your mood. It's not just affecting your emotion. It's connected to your illness and physical health. So this general rate, when there's no COVID-19, the population is actually showing 1.5 times higher chance than the cancer, a higher percentage of population being influenced by mental health disorder compared to the percentage of population being influenced by cancer. And it's 7 times higher than all the infectious disease rate. So we know that mental health is actually very prevalent. And what happens to mental health status of Ontario or Canadians right now during COVID-19? So statistics shows that 40% of young people are reporting excellent and good mental health. And that just tells us 60%, so more than half of the people are not feeling in well mental health condition. And that is a number that's very important and very scary for us to think about. So that's just the general population. What about some people that has pre-existing conditions? And they are called vulnerable group. So there are many people involved in this vulnerable group that is at even higher risk of being influenced by mental health issue. So that includes LGBTQ people, lesbian, gay, bisexual, transgender, queer, and questioning. Racial minorities, homeless, foster care young people, people that have substance abuse issues or experiencing physical and sexual abuse, the economic instability population, and the neglected children. So people are already marginalized in the society is going to experience a lot more hardship at this time, and we need to be aware of that. So what are some knowledge that we can learn from research right now? Because all these factors, researchers are definitely very interested in understanding what's happening within normal population and also people that experiencing less than normal treatments, right? So in the current most up-to-date statistic or research number that's showing in the questionnaire and surveys in Canada, we find that there is 54% or to 48% of people up to May in 2020 reporting a good mental health condition. And that means less than half of people are self-identifying having a good mental health. And that's very likely to be influenced by the pandemic, that more than half of people, so 52% of people are less than very good, excellent health. And among these people, 27% of young people are reporting in good health, and 19% of the adults are showing poor to fair mental health. That means they're not experiencing good health. And 10% of these people are more likely to be elderly, experiencing good mental health. And comparison between men and women, women are more likely to experience anxiety up to 21%. And while in all over Canada, there's 18% of people experiencing extreme, moderate to severe anxiety. Not extreme, moderate to severe anxiety. So some study that I've read, and I believe there's more study coming up. However, currently there's not too much understanding of the mental health issue in Canada, unfortunately. But I looked at studies in other countries. So first one is looking into, I believe the study happened in Europe, and it looks into the psychological impact of pre-existing mental and physical health conditions during COVID-19 pandemic. So this study thinks about how people are being influenced when they already have mental and physical health issue. And the results not surprising. People that had pre-existing conditions are being affected by the pandemic more harsh compared to people that don't have this pre-existing condition. They show a higher risk of anxiety and depression. Another study, interestingly, look at is returning to work during the COVID-19 stressful. So this study is conducted in China and looks at how people are reintegrating into their workplace and how they feel about it. This study shows that when people are going back to workforce, among them, most of people reported low prevalence of anxiety, depression, and lack of sleep. So that tells me when you are returning back to your normal day life, you might actually feel an elevation of emotion, an elevation of mental health status. So it's supposed to be a good thing to go back to your routine life. So let's look at another study focused on looking at student mental health during the pandemic. This is a study done also in Europe. This study shows that 25% of the sample estimated population to have this increased amount of anxiety towards the concern towards their academic performances and the concern towards like economic effect brought by the pandemic. So I think a lot of students right now are experiencing change in their education, changing from learning in classes to studying online, and there's a lot of change in how their marks are being evaluated, and that could bring extra stress. Another study looks at psychological impact of COVID-19 on college students in China, which is showing very similar results. So about 20 to 25% of people are experiencing anxiety, probably due to similar reasons. So those studies are mainly done in China and Europe. And surprisingly, these are actually the country that's leading the research in mental health compared to Canada. So what's the prevalence of stress, anxiety, and depression among general population in different countries? And what I find is a study that cross-look all these studies, all these like individual studies, and summarize what's happening. So this table, what we want to look at is that the study of anxiety and depression and stress, and all these studies are conducted in Asia and Europe with a higher number of articles, so a higher number of research studies happening in Asia compared to Europe. And the sample size that's being recruited in Asia is way higher compared to in Europe as well. However, the prevalence of anxiety, depression, and stress are rather similar. When we look at the numbers, they are relative around 20% to 35%, so showing a pretty high level of drop in the mental health status. And very interestingly, this statistic or survey conducted in Ireland show that there is a 12.2% of people rating their life satisfaction as high, and compared to in 2018, the number was 44%. So there's a 30% drop of people stop feeling satisfied with their life during COVID-19. And another statistically showing report showing the people's idea towards their personal relationship. And when they look at it, they report satisfaction being high, and number dropped from 2018 to 2020 by 20%. So we can see that there is a significant drop in mental health wellness. People are, as a population, are experiencing. difficulties in mental health wellness. And with that accompany a lot of substance abuse, such as alcohol, tobacco, junk food. There is a visible increase of percentage of unhealthy lifestyle. There is a huge increase of watching TV and huge increase of spending time on the internet, and very small amount of increase of exercising. So we can see that being in isolation is not necessarily good when people have substance abuse issue. So what are some psychological impact on the age group of 15 to 35? This study conducted in China used psychological survey assessment to understand the depressive symptoms, anxiety symptoms among younger people. And it shows that upon the immediate outbreak of COVID-19, there is above 50% of people reporting depressed and around 30% of people reporting anxious. So that is a significant number among young people. Not enough statistics is showing us how much psychological impact is happening, but with the social distancing, the International Loneliness and Social Isolation Research Network has looked into it, and based on their analysis of the data, they find that with the social distancing, loneliness at this time of COVID-19 appears to be very high. And it affects the young people the most. So in this graph shows the same thing. So this is statistic, and it's showing that loneliness is affecting about like 20 to 30% of the people, especially in the younger range. Okay, so with that, what we want to do is to provide people with mental health services to ensure their wellness is maintained. However, because this chaotic situation, COVID-19 is disrupting mental health services in most countries. And this data is shown by World Health Organization. And what they find during this time among 130 countries is some of the numbers. So there's over 60% of report in disruption towards mental health services for vulnerable people. Above 67% of the counseling and psychotherapy service is being disrupted. More than 35% of disruption in the emergency intervention. So for those people feeling seizures, feeling substance abuse, there's a drop of help in 35%. 30% of drop in access towards medication for mental health issues and disorders, and above 70% of countries are adopting telemedicine and teletherapy. So that means treating patients through online systems. And what this tells us that the already available mental health services is dropping in its capacity to help people. And most of them are transitioning into online services. But how helpful are these online services going to be? That is a question. So I just want to mention that October 10th is the World Mental Health Day. So keep in mind that we just have that celebration just done. So are these mental health services effective in helping people experiencing mental health issue? And how are well, first of all, we don't think about like most of the services are being transitioned online, and they are done through video calls. So how effective these video calls are for reducing social and isolation and loneliness? One study that's conducted in Taiwan shows that, try to analyze how video calls are, how effective they are for reducing the social isolation and loneliness that might lead to mental health issue. And they specifically look at elder population. And I think it would be interesting to look at younger population as well, but we don't have that research. But what they find is that actually video calls provides little to almost no difference in helping people to conquer loneliness. And that's a very sad result, because the available access we have to human contact right now is mostly done through online and video calls. Another study that's done in England looks at the coronavirus and loneliness. Also shows that COVID-19, online video call has little effectiveness of reducing loneliness in these people. And the statistics shows that chronic loneliness is almost as high as the lockdown loneliness compared to loneliness of all people. So in the bar graph in the far right shows the normal level, and the middle is how lonely people feel during the COVID-19 time. We can see it's significantly higher. So this makes us to think about COVID-19 pandemic. It is an opportunity to strengthen our mental health system and policies, since we can see a very lack of services or effectiveness in this area. We need more legislation at national and local level to mitigate mental health strain. And it will be important to establish the comprehensiveness of mental health education, relieve the social economic stress, and prioritize mental health as an important issue at this time to really increase the workforce in the mental health system. And that also means that we need to address the social economic disparities in mental health and expand our monitor or measuring system towards the mental health status of the population. Because obviously, when I researched, I couldn't find much data related to this issue in Canada, and mostly this data comes from Asia and European European countries. So my next question is that, what are some of your experiences during COVID-19? Do you feel sad, or you feel stressed, isolated, or fear? So if you feel that way, it's actually very normal, because you're not alone. There's a lot of people feeling in the same way. And would you be passionate to help? So if you are, that I'm going to talk about some strategies to help other people. So first, we all know we need to practice self-care at this time during pandemic. So what are some of the things Canadians are doing right now to take care of themselves? One is to communicate with their family and friends. 93.6% people are showing that they are better connected with their family. Exercising indoors, exercising outdoors might be helpful to stay active and motivated to do things. Changing food choices and meditation would be a nice way to practice self-help. What are some ways you can help others? So here is a very simple guide of a basic psychosocial skills for being a COVID-19 responder, I provided a website link here where you can learn more. And the first step is to practice active listening. So there are 3 steps. One is to really active listen, understand what the person is trying to talk to you about. Second step, you want to repeat the message with a keyword so you show that you really heard the person. And the third part would be summarizing what you have understood so you feel like you're really communicating with the person. Another way is to offer practical support. It would be nice that if you can provide the person that needs help with information, with access to food or like access to shelters, give them phone numbers or practical services that can really increase their quality of life. Another interesting way is to adapt the stop and think and go mindset. So it will be helpful at this time when someone needs help to ask them to take a pause, and with all the overwhelming number of questions, ask them to choose some problems to focus on, some problems to solve, and really think about all the possible ways to solve that problem. And when you have the strategy of solving the problem, just go ahead and take action uh, to apply that solution so that they can make a change instead of just like being stuck and feeling anxious all the time. What happens if someone has serious distress? When someone is experiencing serious distress, they might be so upset they cannot take care of themselves or take care of others, and they cannot solve the problems they're encountering. And when you try to help them, it's most important to think about safety first, to make sure that they are safe. They're safe to themselves, they're safe in the environment, and to remain calm and establish trust with this person, listen to them, and offer some practical comfort and information when you communicate. A way to make them feel better at the moment is to do a slow breathing and ask them to think about, the positive things in life, and ask them to cope with the situation. And finally, when they calm down, you can offer them specialized support like psychological counseling or going to some food shelter or somewhere else to, sorry, this keeps happening. Yeah. Okay, so finally, what it means to be a leader during this time. So a lot of us might feel like we might be a leader in their workforce and need to manage a team of people. And at this time, it's very important that you remain a good leader. And what kind of things you can do to maintain that the effectiveness of working or teamwork during this time. So first, you can encourage engagement in self-care for your teammates, create environments that people collectively care about each other's, take the lead as example yourself and become a model of your team to practice, social distancing, to practice time management, all those good jazz. Prepare a training for COVID-19 response for your employees or your teammates, so that they have the right knowledge and they know what to do when there is a crisis. Openly discuss challenging and communicate with people around you so that you can know what's happening and also help them when they need your help up to date. Encourage peer supporting, be aware of the vulnerable or marginalized people in the team. And, when there is conflicts around people, emphasize the importance of being supportive and try to maintain good relationship and promote kindness and compassion towards one another. And finally, there is a lot external sources for you to ask for help. So in Western, there is the movement of called Take Care of Western, and there is a lot of support online. You can call and you can reach out. There's one healing space where we provide international students or general population with professional counseling services. And there's Canadian Mental Health Association, where people practice safe talk, suicidal prevention, mental health. And one of my favorite is the CAM, so Center for Addiction and Mental Health. They provide a lot of guidance of how to cope with COVID-19, and not just for people that have substance abuse history, but also for students and everyone. So again, Western provides many different ways to help, and you can book appointments for talking. So I have Q&A, but if you feel like contacting me, or you can contact through OneSpace. And here are some references of the study I looked at if you're interested.
Okay. Thank you, Mia. Thank you so much. I think I have learned a lot from your presentation today. I don't know if anyone, you're showing your desktop right now.
Okay.
If that's okay, or I can end your.
Yeah.
All right. So if anyone have a question, I do see there are a few people who's waiting.
Oh, there's question.
I don't know, like if you have question, you can type on the chat box and we can answer that. If not, I just want to say thank you. Yeah, like I think your presentation was very comprehensive. It's like super good, and like that's very like time sensitive. I guess at this moment, many people are concerning about the second wave of COVID. So I think it's good to like understand what's going on and how we can like help ourselves and help each other. Yeah. So thank you, Mia. I think you did a great job. Yeah.
Yeah, thank you. No problem. I'm glad to help. And yeah, I hope everybody have a good weekend.
Yes.